The highest risk groups, like the immunocompromised patients and the very, very elderly, are the ones where we'd be looking to see changes to the protocol the earliest.
The National Advisory Committee on Immunization recommends 4 months between first and second vaccination doses, but new studies are casting doubt on that timeline. Dr. Lenora Saxinger, an infectious disease specialist at the University of Alberta, says work is being done to understand the nuances between different groups.
There's some data now on cancer patients, not that much. There's some data now on long-term care residents might have a less good antibody response, which has to be reviewed. And with that, we actually have to keep on looking at the real-world experience, because antibody levels aren't the whole story. We actually want to see what's happened in places where they've had outbreaks in, for example, long-term care, and a large number of people have received their first dose of vaccines.
Saxinger says research is ongoing and provinces will follow the latest advice when it comes available. There's also new information emerging about the effect vaccinations have on long haulers, people suffering lingering symptoms months after testing negative for the virus.
People with those symptoms, at least a good proportion report that they've had reduction of those symptoms after vaccination. There's been, a proportion who said that there's no difference. I don't see any significant signal that anything has been worse.
She says we're seeing lowering numbers of cases in age groups being vaccinated, but with variants on the rise, transmission in younger populations could become out of control, and vigilance is needed now more than ever.
It's a very difficult race right now, and I think it's really important to try to keep the transmission limited as much as possible as we keep on expanding the vaccine rollout.
In Calgary, Taylor Broad, City News.